Welcome to Season 8 of the Lighting Your Way podcast. Hi, I'm Betty Long, your host, and this season we are giving the microphone to those who matter most, our patients. Join us as they share their personal journeys, offering candid insights into their experiences, challenge, and triumphs. Approximately 18% of cancer survivors in the United States are diagnosed with a second new cancer later on in their life. This is known as a second primary cancer, and its likelihood can depend on factors such as the type of initial cancer, the treatment received, your genetic predisposition, and lifestyle factors. In this episode, we explore the experience of Crystal Chuck, a patient who faced leukemia in her 20s only to develop another cancer diagnosis in her early 40s. Crystal's story reveals the emotional and physical challenges, the impact of ongoing treatment, and the resilience needed to navigate life with multiple cancer battles. Crystal shares some pragmatic and insightful suggestions for how to take care of yourself when you're receiving treatment for cancer. Crystal Chuck, welcome to the Lighting Your Way podcast. It is great to have you here.
Hi, Betty. Thank you for having me.
Yeah.
Thank you for thinking of me.
Absolutely. I think you have a great story to tell, and I'm happy to have you on it and that you're willing to tell it. So let me tee this up a little bit. You've been working, I guess it's October, and this year you were working with Jen Prater, one of our nurses, on a healthcare issue. So why don't you share with us what that issue was?
Yes, thank you. Well, it started off kind of very interesting. I'll go back in March of 2024, March 24th, 2024. Um, Me personally, as a woman, I like to do weekly checks on my breast, um, for lumps because mammograms, you know, you don't get them until like 40 or
Right.
sometimes 30, 36.
Right.
Um, so I don't like to kind of like depend on that. So I've always done my
Okay.
weekly checks.
Good for you.
And
Weekly is good. Most,
yeah,
the recommendation is monthly.
but sometimes it's too late. So I'm like, oh, I've always been kind of like paranoid.
Okay.
So I did like the weekly checks, and it just so happened that I did find a lump, and it wasn't small. It was a
Okay.
hard lump in my left breast. And that
Okay.
was on a Sunday, the 24th. And the very next day I went in, called my PCP, got an appointment. And then my doctor immediately, the very next day, got me in with radiology to get that ultrasound, diagnostic ultrasound.
Okay.
And as soon as I went in and they started it, eyes got very big and they already knew that it was something serious.
Oh.
Um, and the diagnosis on that one was a category 5. And I don't remember the actual term for it, but I want to say it's something that's like metastasized.
Uh-huh.
But it's one of
Yep.
the higher diagnoses that let you know that it's something serious and you have to see the breast surgeon.
Okay.
Um, and everything kind of just snowballed. It went very, very quickly. Because in that same week, I went and saw the breast surgeon. Breast surgeon sent me for a biopsy. And that's where we got Jen involved very,
Okay.
very quickly. I had a lot of questions, and anxiety just picked up very quickly. And
Oh,
this
I
is where
can
I'm very
imagine.
thankful for,
Jeez.
yes. um, and this is where it was very helpful to have Jen because she was able to look at the ultrasound and tell me, like, do I stay calm? Because sometimes, your friends and family, they want to give you like the positive vibes and tell you,
Right.
like, nothing to worry about. I've seen lumps. My cousin, my aunt, Santa Claus's wife had this and it was nothing.
Right. Not
But
helpful.
it honestly isn't. The intentions are good, but the impact of it is not. It honestly isn't that helpful because I'm personally a realist. I need to know what I need to be prepared for.
Okay.
And having, a guardian nurse there was very, very helpful because she read it and she said, okay, this does look serious. these are the next steps that we need to take. And so we prepared for the biopsy. Biopsy was not like a normal one. It was a core biopsy,
Okay.
and the tumor did leak. I'll leave it at that,
Okay.
just to
When you
not give
say
you.
leak, what do you mean? It
Yeah,
spread?
like some fluid came out, and it wasn't
Okay.
blood.
Okay.
Um,
And you
and
were
they did
aware of
tell
that
me
when they were doing it.
yes, because the
Okay.
ultrasound, the doctor, the radiologist who was there doing it, she kind of like you could hear the shock in her voice. She was like, "It's leaking. Why is it leaking?" And so I asked her. I said, "Is that not normal?" And she said, "Well, I wasn't expecting it because the way they explained it to me, like most breast cancers or tumors that are in the breast,
Yeah, or
they
solid.
don't. They're
Yeah.
solid. They don't do that."
Yeah, and
So
a leaky, I mean, it might be a cyst, something, some fluid.
right. So that was my question. Um, like, was it bloody or was it like pus like? And she didn't answer. She didn't reply. She just said the only reply that she had was, "Well, I made sure to get samples of it, and we're sending it off to get tested, and you'll have
Oh,
the results very quickly." That wasn't very satisfying.
no, I imagine that just
Yeah, like,
contributed to your anxiety.
it sure did. It sure did. So we did get the results pretty quickly because the biopsy was what, April 3rd. April 9th, the radiologist, they called to confirm that the tumor was cancer.
Okay.
Um, and and this is where more frustration kicks in because it was sorry, the word, they couldn't tell exactly. They didn't have an exact answer what type of cancer. All they knew was that it was aggressive, and the
Okay.
fluid that was leaking out of it was necrotic tissue, like necrotic cells,
Okay.
and that's how we knew it was aggressive. But they couldn't differentiate what type of cancer it was, and that just made it scary. So now I'm anxious and scared because I'm like,
Right.
what
Right.
does this mean?
Right.
Um, and then I had Jen look at it, and I was like, "Jen, please make some kind of sense out of this." And she was able to see, like, she's like, we see spindle cells, we see this rare form of breast cancer, and then we see another rare cancer.
Okay.
So the only thing we kind of know is that it's rare cancer, but let's wait for the doctor to make a decision on what to do next.
And she's looking at the report, right? You
The
guys are
report,
looking, yeah, okay. On
right,
the
right from
pathology.
the
Okay. Yep.
exactly the pathology report. So then the next decision was to not do another biopsy, but to just go in and do a lumpectomy and take the whole tumor out because now the tumor was mad. It was angry. Before
Right.
I wasn't feeling any pain. That's an important thing to note. I do want to make sure I say that.
Okay.
When with this lump, I did not feel any pain originally. It was just there. It was just a lump. There was no pain. Even when I touched it, I didn't feel any pain.
Okay.
And there was no like the skin didn't dimple or anything.
Okay.
And there was no drainage from the nipple or anything.
Okay.
After the biopsy and after poking at it, disturbing it, this thing was mad. We gave it a name. Her name was Bellatrix. Bellatrix was angry. All right. She said, "Why did you mess with me? Like, I made a home here."
I was doing
Like,
okay. Nobody knew I was here.
exactly. It I firmly believe it started growing. To me, it grew faster. And I think it actually was a fact because from the time they biopsy, it did grow a couple millimeters. It
Okay.
did get bigger. So when they did it, they went in and did the lumpectomy to take it out. Unfortunately, we didn't get clear margins. And the pathology came back from the lumpectomy. That's when we found out that it wasn't a breast cancer after all, but a very rare muscular cancer. And the full name of it was lesion 1 stage 2 pleomorphic rhabdomyosarcoma.
Wow. Good job.
Yes.
Good job. So
A
yeah.
lot of practice.
Okay.
Yeah.
So what
And
did that mean? So they surprised? Were the doctors surprised?
they were very surprised. My breast surgeon, and I'm gonna give her a shout out because I this is the first doctor I had that was so. She made me feel like she really really cared. Like she called me. If I just sent her a message, she'll call me after hours because she wanted to make sure that I wasn't like up thinking about my results or waiting for results. Whenever
Wonderful.
she got it, she
Yeah.
made sure I got it. And this is Dr. Flannery with MD Anderson at Cooper.
Okay.
Dr. Kay Yoon Flannery. She honestly is one of the best to me, in my personal
Yeah.
opinion. I feel like she's
Yeah.
one of the best for several reasons. Her bedside manner, everything. Um, and I told her, like, give me things straight up. No need to sugarcoat. You don't have to baby me.
Okay.
And she did just that. But she also was very, very, very caring. Um, but she did as soon as she got the results. And I want to say she called me at like 7 p.m. And you can hear her kids in the background eating dinner, but she just, you can hear she was just as shocked and devastated. Because we had been looking at one area, I had even had my lymph nodes removed and checked,
Okay.
but just to find out it's something else. And so now it's like the panic of, well, now I need a PET scan to make sure it didn't spread anywhere
Right.
else,
Right.
you know?
Had they probably didn't have time to do any other scan or imaging before your surgery, right?
Right. No, they
Because it
didn't. They
sounds
didn't.
like it went pretty quickly.
Yeah, everything was because I found the lump in March. Lumpectomy was what, April? I want to say April 16th.
Wow.
No. Surgery day, lumpectomy. April 19th was the lumpectomy.
Wow. That's lightning quick to get
Yeah,
everything
everything
done.
happened so quick.
Yeah, which can be good, which can be bad, right?
Yeah.
Because
It,
you can't wrap your head around all this. It's good that they're moving quickly and you're getting the support you need, but you also are moving
yeah,
quickly and you can't get your head around it.
that's exactly how it felt. It felt you remember those topsy turvy like games and
Yeah, yeah,
yeah, that's how I felt. It was like every time I got like to a balancing point, I'm like, okay, this is what we're dealing with. It seemed like the very next day or 2 days later, I was being rocked right off my balance
right,
board
right, yeah,
and having to catch my balance again. And I couldn't catch it. I couldn't catch my breath. And it was just constantly scary.
yeah,
Um, and then a little bit more background, like it just felt very unfair. That's the only word I can explain. So it's like I did shut a lot of people out. I didn't want to talk to anybody because I'm 40, but when I was 25, I want to say I was 25. Back in 2009, I was diagnosed with acute promyelocytic leukemia.
oh,
So it has something completely different.
oh,
And it just felt very unfair because it was like, I did my time.
right, right.
I already did my time. I already beat it.
I got through this. Well, was this cancer a result of the treatment of the other one?
But no, because I know the chemo that I received when I had that cancer, the risk of a secondary cancer is possible,
Right.
but I think they said it would be a secondary leukemia. It
Oh,
wouldn't be
okay,
something like this. So it
okay.
just felt very unfair, you know? Um,
How did you deal with that?
it was
Okay.
a lot of talking to God. And the way I am, I kind of tend to, I don't dwell on things for too long. I get it out. It's just I get it all out, cry it out, and then it's like, all right, it's not fair, but now I have to deal with it. Deal with the cards at hand. Control what you can, and then let go what you can't.
Right. Okay.
So
Easier
now
said than done, right?
it is. So it's just like I deal with the emotions as they come, but I don't dwell on them, if that makes sense. Like I try not to
Yeah, I'm
avoid them,
right.
but I handle them when they get here. It's not fair. I cry it out, I curse, and then let it sit for a day or two. And then I'm just like, all right, Crystal, don't stay here. Don't stay here because then you're going to drown in darkness. And where the mind goes, the body will follow,
That's good
you know?
advice. Yep.
So I did have to constantly remind myself that. And I would get up and do certain things, even if that meant like take a walk
Okay.
around my apartment building or, I picked up scrapbooking.
Okay.
I love getting, I'm very old school. I love getting like things in the mail, like cards, get well cards. I have a
Okay.
great community of friends. My coworkers are my friends, and they would send me things, and I just started scrapbooking that. And then when I did feel sad again, I allowed myself to feel sad. Um, and then just be thankful for, I paid attention to the things that I was thankful for, which was making things like having Jen, guardian nurses, because I didn't have that last time. And just
And
asking her,
yeah,
sorry,
I
go
guess
ahead.
it made a difference, I'm sure. Cuz
Oh my
plus you were
gosh.
younger. You were way younger.
Yes, yes. It made such a difference. Every time labs came back and I'm like, what are these words? What is this? What does this mean? What does this count mean?
Right.
I don't know what this is. How promising is this? That having her to bounce off of and explain things to me made a world of difference. Um, when I went to get a second opinion, I won't name the hospital, but they were really good, clearly very knowledgeable, but I didn't want to feel like it just seemed like they were very excited to take on the case because it's so rare and aggressive. Like, I don't want to be just another study you can write a paper about.
Oh. Did you say that you felt they were excited about that or no?
Yeah, it felt
Oh, they
like they were
were.
very excited, like,
Oh.
oh, all, like one of the first things they said was just like, oh, I already talked to the rare cancer and tumor board about you. You have a case on you. And it was just like,
Mm,
all right,
right. Good for
you
me,
know,
right?
yeah. And I was just like, okay. Versus, and they have like everything was all mapped out and strategic, but sticking with MD Anderson at Cooper, what the determining factor was, one, I was already a patient there. Two, I felt like a person, not
So
just
you,
a
yeah.
patient and a potential paper to write.
So you felt like they cared. Certainly, you felt like Dr. Flannery cared from what you
Yes,
said.
yes,
Yeah.
yes,
Interesting. So was that in terms of your decision? That was the determining factor that I don't want to be a
absolutely,
paper. Okay.
absolutely, absolutely. And then especially knowing that I love that they took the time to consult with MD Anderson in Houston. They were involved as well. Um, and how
Did
they asked
Dr.
me to.
Flannery drive? Was she your attending physician? Did she take care of you throughout, or did you move to oncology?
Off, every, so Dr. Flannery was my, how do I explain? Yeah, she dealt with me for the surgery part, but then when we found out it's the pleomorphic rep, PRS, when we found out it was that, then it switched over to medical oncology.
Okay.
Um, so then I have Dr. Chrisman, and then I have a radiation oncologist. Sorry.
Okay. So you got
Um,
both chemo and radiation?
well, now there's that story. I did have a port put in, and I was supposed to get chemo. I was supposed to start chemo, but so the size of my tumor ended up being 4.7 centimeters. Then we didn't get clean margins.
Yeah.
So then we ended up having to go in and do a mastectomy. So Dr. Flannery did the mastectomy. And, unlike normal mastectomy, she did remove some more muscle tissue because it is a muscular cancer.
Okay.
And when she went back in, she was able to get clean margins that time, but she did find more cancer. And altogether, that made the size of everything 5.1 centimeters.
Wow.
Now, the problem came where I needed the chemo, but I wasn't able to get it, was because the chemo that I needed, they call it the Red Devil, Atra. I
Adriamycin?
Adriamycin,
Yeah.
yes. I already received that when
Oh. Oh.
I had APL,
Oh.
and I had received 50% of that in my lifetime. To take me over that would give me heart damage
Yeah.
and the secondary cancer we talked about earlier.
Oh.
So the medical oncologist, Dr. Krisman, she consulted with Houston, MD Anderson, and they said, let's not risk it and let's just go with the plan to stick with the mastectomy and radiation. And then we'll
Ah.
just do,
Okay.
right. And then
Oof.
we'll
Yeah.
monitor for 2 years. Every 3 months, I'll go for an MRI and CAT scan,
Okay.
which still does give me anxiety because I feel like I'm just kind of like waiting for the other foot to drop
Mm,
constantly.
I'm sure. Yeah. I mean, given your history, right?
Yes.
It's. But you're
Yeah.
through all of your treatment at
Yes,
this point.
I did 30 treatments of radiation. So it was 6 weeks, 5 days a week
Wow.
of radiation.
Wow. How was that for you? Was it exhausting?
It was, for some reason, I've never done radiation before, so this was like a first time for me. And for some reason, I thought it was going to be like the easier option because I've done chemo and I know how bad chemo was.
Everything's relative, right?
Yes, yes. Wow. Let me tell you, lesson learned there. Um, I was exhausted. Radiation is exhausting. I was tired all the time. I was very tired all the time. And then my skin held up pretty good until like the last day.
What? No.
Until yes, the last day. Until the very last day. And they recommend you use Aquaphor.
Yeah.
Now this is me personally. That very last day, Aquaphor was not doing it for me.
Oh.
And it honestly made things worse. So I
Oh.
stopped the Aquaphor
Mm.
and I found a cream that worked good for me
Okay.
personally. And it's natural. Um, I would like to suggest it,
Yeah,
but
sure. What's the name?
uh, everybody do their own research.
Yep.
But it's called, it was on, my friend found it for me um, on Amazon. It's called Radiation Relief Cream.
Oh. Wow.
Uh, and it worked wonders overnight because I went from looking like a burnt rotisserie chicken cutlet,
Oh.
and I'm talking bleeding and everything.
Oh.
And that area underneath the arm,
Yeah.
the skin is like thin right there. So that's where most of the damage was, the skin
Mm.
damage from radiation. And you have friction there because you're moving your arm, you're moving
Sure.
your arm.
Yeah. Right.
But it's like overnight, this cream worked.
Wow, that's great.
Um, and the brand is called Ultimate Vitality, and it's the unscented radiation burn relief cream.
Wow.
And the main ingredient is the calendula in the cream, and
Okay.
it's all natural, organic, paraben free.
Good to know. That's a
Yeah,
good tip. Thank you for sharing that.
you're welcome. And now it's just physical therapy and taking everything one day at a time.
So how are you taking care of yourself? Are you still going for walks? Are you back to work yet?
Definitely taking walks,
Yeah.
reading.
Okay.
I've been reading. I took this time to like go back to reading books. Um, that was a really nice distraction. I had to get off social media and put the electronics down. Um,
Why,
that was
Crystal?
a big,
What was that doing to you?
um, because I was I was doing things like searching, looking up,
Oh.
you know, and that was not helpful. But then also like seeing, comparison is a thief of joy. And, seeing everybody kind of just living life, and it did kind of affect me a little bit.
Oh,
Um, and then seeing also just sometimes positivity can be a little toxic. The intentions are good and I'm grateful for it, but sometimes getting a lot of messages that are just like, you need to become vegan, you need to watch what you eat.
oh.
They weren't as helpful as, a lot of people thought it was.
Right. 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 That's very, very well put, Crystal. I've often said to patients, like you said, people mean well, their friends reach out, and it's frustrating to them. And I say, you
Yeah,
should just really say this isn't helpful, right? Because
yeah,
to your point, your experience is your experience. It's not
exactly.
everybody else's. So good for you.
Oh,
So you
yeah.
can't. So are you back on social media? Or are you still having a?
Still kind of taking a little break. Like I'll go on just to say like give a little update, say hi, and then I'll just hop off really quickly before anybody has a chance to say anything. It's just like a hey, love you
I'm still
guys. I'm still
here. Still
here.
here. Good. Yeah.
Yeah. And then I'll run off
Right.
really quick.
And your life
Yeah.
has not changed, right? Like that's I think
Yeah.
social media can sometimes be so consuming. It can be
Exactly.
distracting and, to your point, a thief of joy,
Yes,
of
yes,
positivity.
yes. Yeah.
So
And then
when you
for
go ahead.
sorry, for work, I do want to say this part work wise. I was very, very, very lucky to work at a company where um you always have hear that company always says, they put you first or they put family first. I was lucky enough to work at a company that actually meant it. And
That's great.
without hesitation, I really didn't have anything to worry about. And I was able to be home and just honestly worry about my health. Um, I did
Great.
try to go back to work several times, and
Yeah,
I
how'd
got
that
yelled
go?
at. I got yelled at. They said several times, they were like, nope, nope, just focus on you. And they were so right, because there were times where I didn't even know I was tired and I just was nodding off, or I had no energy. Um, and I was not going to make it through a whole day in the office. Or I felt pain and didn't realize I felt pain.
Oh,
So I was very lucky to work at the company that I work at, and have so many caring people around me in that company. Even them setting up, a lot of my coworkers set up the GoFundMe, and
right.
so many people from the office that donated, and they're the reason why I was able to, keep up with my bills.
Great.
So, I'm just so thankful and so blessed to work where I work and work with the people that I work with.
Well,
My
I'm sure
clients
they feel the
included.
same way about you, right? Because I'm sure they missed you.
Yes, yes, I'm so grateful.
So
And
what would
through them,
go ahead.
guardian nurses. I keep saying I have to keep shouting out guardian nurses, and having Jen being an advocate for me with all these appointments. And um sometimes you feel kind of, well, I don't know about anybody else, but sometimes I feel stupid and asking certain things, and I'm like, does that make sense? Like, and she's like, it makes perfect sense. I'll ask about it.
Right.
You know,
Well, that I appreciate that. I mean, that's why we're there, right? So that
yeah,
you can focus on the answers and we can ask the questions. And if they don't make sense, then hash it out, with the doctor
Yes.
and the nurse practitioner. Crystal, when you think back, I mean, I know you're still recovering, but what was, if anything, was the most frustrating of all the challenges of being a patient?
I'm so glad you said that because I know exactly the most frustrating thing. Um, Surprisingly, it's the paperwork, the
Uh,
paperwork,
uh,
the FMLA, having to keep up with it. And this is where I don't know if it's because I just got lucky with such a great team of doctors.
yeah,
It was two things. I'll say there's two things. Trying to decide which treatment would be better because I was very, very stressed about the decision of I really felt like I needed chemo because I wanted to treat it systematically because I felt like it would hold off a reoccurrence much longer than 2 to 3 years, and I'd have a longer chance of survival for
yeah,
as far as cure rate.
right,
So that was really scary when I heard that getting chemo would, it potentially give me heart damage and kill me. So,
okay,
and then I felt like just doing radiation would only treat it locally, and then I'd have a risk of it coming reoccurrence within 2 years. Like that was scary to me. So I
yeah,
was like, I feel like I'm just getting two options of not good.
oh, okay,
And, I'm having to pick between those two. Um, and then having to decide.
yeah. It's a
And then
big
I just had
decision,
to,
big decision.
yeah. But then it was just like having the doctors that I had that were just like, listen, even though chemo's not an option, you have a good team of doctors. So even if, let's say, we do have a reoccurrence in 2 years, we're going to be here to take care of it. We're going to cure it right now. And then who's to say it will come back? Let's
Yeah,
just live in right now.
right, right.
So I'm very thankful for that. But the other frustrating thing that just constantly made me panic was having to deal with the FMLA paperwork and always having to stay on top of it. And there was a point in time where they lost my paperwork, and I had keeping track of dates and making sure my benefits were coming in, the short-term disability benefits.
Right.
And it's like if I didn't fill it out on time, I might not get it. And then it was pending for like 2 months.
Oh,
And I'm like, imagine be like I'm going through all of this and then I still have to like log on to the state side. I have to log on to my portal and then I have to fill
right.
this paperwork out. I have to take it to my doctor. Like if I didn't have Jen to help me with a lot of it, I would have been pulling my hair out.
Oh,
I'll be very honest with you. I've lost the job before because of this.
oh,
And it did give me
yikes,
like some PTSD.
yikes. Yeah.
So it was very, it was very, 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 very stressful. That might have been like one of the two most frustrating things.
Okay. I appreciate that. I mean, that's not an answer I've heard. So that's a good. It's kind of
Yeah.
an introduction to thinking about how if we could minimize that, right?
Yeah.
For
I
patients that we work with. Huh.
definitely
Okay.
make sure you have like a lot of your paperwork either. And a good tip to do, I would say, is to fill out a lot of your paperwork for your doctor, and it will make that process go by faster. So all they have to do is just
Just sign it. Right.
yeah, all they
Sign
got to do is
here.
sign it, send it back. Less work for them to do. They'll
Right.
appreciate it.
Right.
They're very grateful
Exactly.
for it. And keep track of all
Smart.
your
Smart
dates.
woman. Smart woman.
Keep track of every single date because that was the one thing that like I got hung up on the most was just like which date is which
Okay. Like
because
what's due. What's due when and.
what's due when, or even more so, like,
Like
because like
appointments and stuff?
you know how I went over how many different doctors I had.
Yeah.
I had to fill out
Oh,
um a new a new what do you call it? A new sorry.
what, like a patient information thing or new form, eligibility form?
Yes, for every
Oh,
time. So
oh,
for the lumpectomy, being out for the mastectomy,
oh,
I had to put in a new request for that. So I had to
oh,
put in the dates for that.
oh,
Like
gotcha.
and every time is different. Like the mastectomy, I was out short term for that, but then it was an intermittent for the lumpectomy. So that's a whole new request. And then
Gotcha.
radiation, I was going to be out short term for that, but then that was just a continuation from the mastectomy, but it's a different doctor. So you still need to submit something different for that.
Oh,
So it's like keeping track of the dates. Like, when did I go out from this date?
wow.
When was this? And then what did and you have to put exactly what you put, or it's going to
Could bounce
it
back. Yeah.
bounce back.
Right.
Exactly.
Right. Yeah. They don't make it easy, honestly.
They don't. And I
Yeah.
feel like this is the time where it should be easy,
Yeah,
you
there's no
know?
easy button. No easy button for healthcare, that's for sure. Or
Yes.
for any or paperwork. So Crystal, when again, when you think about your experience, what would you like to say to other patients who might be listening who maybe don't have had the same diagnosis but who are
Mhm.
struggling, say with breast cancer or any other cancer? What would you like to say to them?
It's going to be two parts. For the physical, when you're doing with the if you have to have a mastectomy, I know a lot of, because the one thing I kept hearing was, I know I got pushed a lot to, oh, just cut it off. It's no big deal. It feels like you're losing a limb.
Oh,
And I don't think that gets talked about enough. You're losing a body part. And men also have breast cancer and they get mastectomies too.
right.
Don't feel pressured into just like these positive thoughts of, oh well, I'm losing my life. I'm saving my life, so it's just the breast. It's fine. Like, prioritize your mental health, and if you need to join a group, that's a good advice that I got too. If you need to join a group of people that are going through the same thing so that you guys can just like either cry together, support each other, and go through the same things and not just constantly feel like you have to fake the positivity. Like,
Okay.
yes, I'm so strong. Like, it's okay to not feel strong all the time.
Good advice. Yeah.
Um, and then on the physical side of it, uh, prepare your home, get a bidet, have a bidet.
That's a
Me
very
personally,
pragmatic suggestion.
I'm a hyper independent person. I do want to talk about this because I did see this a lot um going into the cancer center. Um and this, of course, this was with no bad intention, and I understood it completely, but I got asked a lot. I'm a single woman. Oh, is your husband here? Is there somebody at home that's going to take care of you? And a lot of people were coming in with their spouses, and I wasn't. I was coming in with Jen. It was just me and Jen, or sometimes my son came in, or I had a friend that came in with me. But if you're single and going through this, you might have a couple moments where you're just like,
Yeah.
dang, this would have been nice to have somebody
Yeah.
on an intimate level that helped or supported. you know
Right.
don't feel overwhelmed. Let that moment come and pass by,
Okay.
and don't let that overwhelm you.
Good advice. You have some great suggestions, and I'm sorry that you had to go through what you went through to have this advice, but you certainly are insightful about
Thank
the
you.
experience that you've had, for sure.
I appreciate you, Betty.
Yeah. So
I
what would,
appreciate what you're doing with this podcast as well.
oh, thank you. Yeah, I think the comments and the suggestions and just the way you're talking so honestly about your own experience will be helpful for someone.
I hope
So
so.
thank you. So what my last question, what would you like to say to the doctors and nurses who are listening? Not necessarily the ones you gave a shout out to, but the ones
Yes.
who say maybe at the academic medical center that you felt
hmm
like you were just a paper. What would you like to say to those doctors?
Um, well, I do understand, while I do understand that, you pay all this money for med school, you're in a lot of debt with student loans because and a lot of times it's because this is what their passion. This is their passion.
Right.
So they're probably very excited and didn't think they'd see something like this,
Right.
but just try to remember you're sitting in front of somebody whose life has changed. And, you know, like with me, I've had my life has not been easy. My life has not been great at all. And when I got to a moment, a year in my adulthood where I'm like, okay, now it's finally gonna go good. And I just got hit with another truck. That's not what I wanted to hear from that doctor,
Right.
that you
Right.
just hit the lottery
Right. Right.
in your career, fresh out of med school. Um, you know, Try to remember act like you're talking to a family member. And then, when I leave, jump for joy. Call your friend. Just try to treat every patient like, even if it's fake. Um, just try to remember that little bedside manner, especially when you're dealing with these rare cancers, rare tumors.
Right.
Try to hide your excitement a little bit.
Right.
Um, and then the other thing is, we're in the US, obesity is at a high. You know, can we just be cautious about that? How we talk to our cancer patients. And wait, this part has nothing to do with me. I didn't experience anything like that, but I did run into another patient who was supposed to be getting
Yeah.
reconstruction. And at that same facility, she was told that doctor said that they weren't going to work on her because he's never seen somebody at that weight, and just didn't feel it was a plastic surgeon. He didn't want to do the breast augmentation, the reconstruction, because he's never seen somebody at that size and he didn't feel safe. Like, there's a better way to say that. After
Oh.
taking a series of pictures of her,
Oh.
and she went into a deep, deep depression
Oh. I'm
after just
sorry.
fighting cancer. You know,
Oh.
again, we respect the profession, understand it, but there's other ways to say that when we're literally fighting for our lives and
Oh.
don't
For
know
sure.
what the future holds for us. The last thing we want to be told is, you're an obese cow. We have mirrors, we know what it looks like.
Right.
Just taking off the weight isn't as easy.
Well, I'm sorry for her. That's an awful experience. I mean, you feel
Yeah.
traumatized at that,
You're
right?
traumatized.
To
Yeah,
your
bad
point,
enough that
you
it's
already
like
have
adding on
cancer.
the
Right.
trauma.
Right.
Exactly.
Right.
So, yeah, just those couple things.
Okay.
To work on the bedside manner, work on, recognize when you're being condescending.
I, that well, speaking of insight, I don't know if there are some doctors that certainly we've met through the years that don't have that insight, and need to be called out for it gently,
Yeah.
gently. But
Yeah.
I think it's important, even when our nurses go in to accompany patients and they have an experience where a doctor is perhaps condescending or dismissive. More importantly, dismissive. I think we see that a
Yes.
lot.
Yes.
Um, to speak to it and to remind them that this is a patient. To your point, maybe it's your mother, maybe it's your sister, your brother. Have a little
Yes.
compassion. Little compassion.
Agree.
Yeah.
Absolutely agree.
Well, thank you. This has been a really, I really enjoyed the conversation, and I again thank you for sharing so much with
Thank
me.
you.
Thank you, and can continue to get well, and keep taking those walks, and this will be behind you.
Thank you so much.
All right,
Thank you
kiddo.
for the time and the space. And I look forward to listening to more of your episodes.
Okay. Thanks, Crystal. All right, take care. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you found our conversation helpful, please share it with your friends and leave us a review. You can learn all about how Guardian Nurses helps patients and their families when they need it most at our website, guardiannurses.com. So until next time, find some joy in your life and pet all the good doggies and kitties, and remember to tell your people that you love them.